that led me to work here. I grew up on a small farm in the Great Lakes Bay region. I did well in school and decided that I wanted to be a doctor during my undergraduate years at Michigan State University. I volunteered as an orderly in the emergency room in Lansing, and I loved it. I went to the University of Virginia for medical school, where I learned what a privilege it is to have people share some of the most personal details of their lives with me. I wanted to make a significant impact in people's lives, so I was planning on being a medical missionary overseas in third world countries where I felt that people really need help. But let me tell you what I learned during medical school and my family medicine residency. During medical school, I found a 3-year-old dying from AIDS who needed someone to spend time with her and care about her. I found a Vietnam veteran living on a couch in someone's backyard with foot ulcers because he had no shoes and wore used boots that did not fit him correctly. In residency, I found a 40-year-old woman in a coma because she did not have thyroid medicine, a very basic, inexpensive medicine. I found a 4-year-old boy with a heart murmur who could not get an ultrasound of his heart because he did not have insurance. I was working hard to make a difference in people's lives when I realized that I was the one being transformed. I have seen the depth of need of many of our neighbors and friends. Many people in our community only need someone to advocate for them, help them understand how to manage their health problems, or teach them healthy habits in order to be able to get better, achieve independence, or be able to hold down a job. Here at Great Lakes Bay Health Centers, we can transform these lives. Great Lakes Bay Health Centers provides quality health care for everyone seeking our services in a 16-county area of the Great Lakes Bay region and beyond, regardless of insurance coverage or income, through touching lives, healing people, and building community together. We touched lives this past year by obtaining a 3rd dental bus, which you saw outside, and you're welcome to tour after. And this dental bus has enabled us to provide more children with dental clinics at their schools. But this bus also has a wheelchair lift, so we can begin to provide services, dental services, to people who have limited mobility. We helped heal people this last year by hiring community health workers for each of our primary care sites, so that we were able to start walking clubs and provide motivational coaching to help our patients lose over 900 pounds. We helped build, we helped build community by initiating outpatient substance use disorder treatment in Saginaw, and screening and short interventions in many of our primary care centers. Through medication and counseling, we have already helped more than 1,300 people struggling with substance use disorders in our first 6 months of operation. This was made possible thanks to the help of all of our donors, especially our Giving Society donors. I know that there are so many more lives that we could be transforming. On a daily basis, we receive over 200 calls from people asking for medical appointment that we have to delay because we don't have an immediately available appointment. When we opened one of our dental centers, we had over 1,000 people call for an appointment our first day open. One dentist can barely see 1,000 people in a year. For substance abuse treatment, we have only just begun to assess the level of need in our patient population and in our community. I dream of a day where we do not have to delay care to hundreds of people every day who are asking for medical, dental, eye, behavioral health, and substance use disorder services. In order to accomplish this, we will need 2 more dentists that will help us reach an additional 30 dental patients a day at our downtown dental center next door, slated to open in May. We are also committed to expanding eye services to twice as many people in the next 2 years. Great Lakes Bay Health Centers is the only eye center in Saginaw that will provide both exams and glasses for all of the Medicaid insurances here locally. We initiated eye services a few years ago, and now our optometrist is booked out 6 weeks. We want to hire another optometrist so we can help people see effectively, work, and care for their families. We are also committed to providing outpatient substance use disorder services to an additional 2,000 people in the Great Lakes Bay region in the next year. We need at least 4 more psychiatrists and counselors to provide this treatment for people who are currently struggling with addictions in our community. I invite each of you to join me today in transforming the lives of tens of thousands of people throughout the Great Lakes Bay region by joining our mission, changing lives because you care. Now I would like you to hear this story of transformation through the words of the people we serve.
Well, I was 4 months pregnant. I just discovered I was pregnant and I was in a panic. I didn't have insurance and didn't know where to go. I worked with a friend of mine who was also pregnant, and she told me that a mutual friend of ours worked here and that when she was seen, she wasn't required to have insurance. And that was my biggest fear, was coming to a doctor and getting this insane bill or trying to qualify for insurance and not qualifying because I didn't know what the requirements were. I was super nervous at first. It was my first time being pregnant, my first time really just having that type of women care, period. I was diagnosed with cholestasis with my son. With the cholestasis, I had to be seen once a week and then twice a week, which I became very familiar with the staff here, and then they just became family because they were so used to seeing me. Went from nervous to loving this place. It's like almost like a second home. I always heard that when you had state insurance that you just didn't get the quality care that you needed. And so I was super surprised when I came here because what type of insurance I had didn't matter. After everything I've been through with my 2 pregnancies in 2 years, I tell the world, I tell every single pregnant woman that I see that if you're not coming to Great Lakes Bay, then you're not coming to the right place. My life is in a completely different place. I am so happy, so blessed to have my 2 kids, my amazing man, soon to be husband, and just loving life.
Oh, I hit rock bottom real bad. No job, broke, drinking all the time. Just didn't care about life anymore. Till I came to the Ruppin Center. Just they opened my eyes. There was still a world out there. Finally went in to see for a checkup because a lot of stuff was going wrong. My doctor also told me we can have somebody else will be here for you emotionally. And she said, I want to introduce you to a lady named Miss Connie Slesson. If you take it like that.
My role as a community health worker is to help patients help themselves, get the resources that they need that are available to them in the community.
She's like a saint walking on earth. She brought truth to them, helped me out, got me medicine when I didn't have nothing. I had no money, nothing. She went above and beyond what I could have ever said to a human being to do with another person. It was because he's somebody like me. Body was just like breaking down. I was in not only an emotional rape, but just also physical rape. Overweight, bad. With my doctor, Ms. Harrison, she hit me on every level, so she's making sure that the eating is going to be good. She cared about how I honestly felt inside, not just physically.
Ruben was struggling with wanting to work. He wanted to work. He had elderly parents at home that he was taking care of and wanted to know what he could do. We gave him the tools. He did the work. He got the job. He has health insurance. He has gotten his blood sugars under control, just doing phenomenal, and he did all the work.
Ever since I've gotten healthy to the doctors and my social worker, life has been great. I mean, having a thriving career. See, these people care. They deep down, they generally care about you. It's not about the dollars and the bills or the how much they're gonna make off you because they're seeing you and treating you. But it ain't nothing about that. They care. I'm living proof. They care. I want to be there. I can't stress that enough. I will not be here if it wasn't for Clever Up Center.
I never took the time to go see my doctor to check myself out. I didn't too much care about it because I was more focused on taking care of my kids, providing for my kids. The symptoms started when I was over my friend's house and we were just laughing, talking, and the only thing that I remember saying is, I can't breathe, blacked out. Woke up in the ICU and I'm just looking around and I heard the nurse was like, well, good morning, sunshine. And when she said that, I was trying to say good morning. I was like, where's my voice? Where am I? I had to learn how to walk, talk, eat. Once I got the talking under control and the walking and the eating, it was like, okay, what's the next? My goal for my Mind Care program was depression. I didn't want to look in the mirror because when I look in the mirror, it was that reminder of me being in the hospital because of my trait. I was ashamed. I didn't grasp the fact that I got to learn how to love myself with the trait.
So a patient is eligible for the Mind Care team if they have a chronic condition such as diabetes and hypertension and depression and or anxiety. So we have enrolled 716 patients in the program to date, and we're excited to be extending that program for even longer than initially to help more patients.
I got over the depression. My second goal is my weight. Trying to get back to me. Mind Care, they call me, they text me about the walking club. So me walking, I'm like closer of my goal of losing weight. I'm making friends, I'm enjoying life, I'm laughing. What keeps me coming? The nurses, the therapists, the psychologists. They actually genuinely care about my well-being, trying to show me ways of doing things in a healthy manner. I feel radiant. I feel great. The dark cloud it moved away, you know what I mean? So I feel great on top of the world.
Hello, my name is Ruben Redardi. I'm 45 years old. I live here in Saginaw. I'm a patient with the Great Lakes Bay Health Centers, and I'd like to tell you my story. I started coming to the Ruffin Center in 2015. I was broke, I had nothing. I was in real bad health, and I had just given up on life. I had just said I had enough. I was suicidal. I was having suicidal thoughts, and everything in my life had just gone bad. So the last straw was when I got a third drunk driving, and I got locked up, and I had to look at my life and say, am I going to try to transform my life? Where am I going to get this help from? So never had a doctor since I was a kid. So a couple of times I broke some ribs, seen a doctor for that, but never got any kind of care from anything. So when I got on Medicaid, they sent me to the Ruffin Center because that was the only option I could have. So I was nervous. I didn't want to go in there, but eventually I said, hey, I got to see what's wrong. Everything seemed to be going wrong in my life. So when I came in there, the doctors were just great. Social worker was great. They just talked to me, and I told them the whole truth about my whole life. How I was a 19-year addict. I'm in recovery now, been almost a decade, and they helped me emotionally, what I really needed. So when I finally came there, I thought I had an infection. They did a blood test, and they found out that My sugar was over 700 milligrams, so normal level is under 180. So I found out I was a diabetic, and I was at the stroke level. So, finding out that you had diabetes, and my eyesight was starting to get really blurry, and deep down I knew I needed help. So when I got to the Ruppin Center, and I finally made myself go in there and go and get help. I just broke down and cried. Got real emotional. And I was trying to, telling them what I wanted to do, and I wanted to become a nurse, seeing how nurses took care of my family. Well, then we got here, and they helped me, and they got me the counseling that I needed. And I found my passion in life again. So I was able to go to nursing school. Now I'm a CNA. I take care of people. How people take care of people. I work in a big facility now, and it feels so good to help people like people help me. So I'm getting back healthy again. My doctor is getting my diabetes under control, and my blood pressure's under control, and I'm strong as an ox. Go to work every day, volunteer whenever I can. So hopefully I'll be off the insulin soon. Just take pills. But if you really want to change your lifestyle, I urge other people to come to the Ruppin Center and come to Great Lakes Bay Health Center, because they will help you. Not just for your body, but they will help you mentally. They want to know what's going on with you, physically and mentally. So I was referred by Medicaid, and I won't go nowhere else. They try to maybe go to other places, but now that I got more insurance, and I'm like, no, I won't go nowhere else. I'm at where I want to be at, and this is where I'll be at forever. So thank you. I am now a success story, and I'm helping other people get healthy and become a success like me.
Hello, my name is Christy Patel, and I'm a patient at Great Lakes Bay Health Centers in Imlay City. I found Great Lakes Bay Health Centers after I lost some income from my late husband's Social Security, so I qualified for Medicaid. Before that, I did not have any insurance for 12 years, so I just didn't go to the doctor. I had bought some insurance for $200 a month for the last 5 years, and had been driving to Metamora to see a doctor that I could go to. I was glad to find Great Lakes Bay Health Centers in Imlay City was open to everyone right in my town. That's where I met Dr. James Brown. I was diagnosed with diabetes 4 years ago. My dad is also a diabetic, and so are my 2 brothers. My mom was a diabetic. She died from pancreatic cancer in January. She had symptoms and pain, but her doctor wouldn't listen to her. She died 2 months later. That's why it's so important to me to be heard by my doctor, because I remember how many times my mom's doctor didn't listen. I didn't realize how bad after that my mental health was. I was just getting by. But Dr. Brown had helped me so much that I'm in a totally different place now. He was the trigger. I started writing in a journal. I also write down everything I eat before I eat it. I have lost 24 pounds, and I am setting my blood sugar numbers improving. My plan is to get rid of my insulin altogether. A previous doctor told me I would always be a diabetic. When I first came to Great Lakes Bay Health Centers, Dr. Brown told me it doesn't have to define me. I look at my children and my grandchildren, and I want to break the family history chain. Dr. Brown and I set goals together. I want to make him proud of me. I want to be healthier. Life matters more to me now, and if I hadn't found this place, I probably would have just stopped going to the doctors. And, well, with diabetes, it's not good. After my second appointment there, I wrote this letter to him. Dear Dr. Brown, I just wanted to write you a note to let you know how much you have changed my life. From the moment I met you in your office, I could feel your concern, compassion, and genuine care, not only for my physical health, but my mental health. I have been treated for diabetes for years. You were the first doctor to take time to help me out finding what is causing my issues, not just prescribing me a pill. I refer everyone I talk to this center, including my own daughter. You see, I brought my daughter to see Dr. Fahey, her OB care at the same center. He has changed her whole outlook on her pregnancy. She had a miscarriage in January right after my mother passed and was very anxious. At her first appointment, he spent 45 minutes reassuring her and showing her the baby to give her peace of mind. She got, at the same appointment, signed up for WIC to support pregnancy health. I can honestly say I have never had better doctors than here, and I thank God for you. I am very blessed, and you did change my life. Thank you.
Good afternoon.
Good afternoon.
I'd like to thank, first of all, Christy and Ruben for your great story. I'm inspired. I had a chance to sit with them prior to this, so I had one of the best seats in the house, and I got to know them a little bit better. And I want to say Great Lakes Bay is in good hands for the future. Hello, I am Salim Manan, and I am a longtime patient and board member. And now I am a volunteer ambassador for Great Lakes Bay Health Center. I've been a patient for close to 30 years, and all my family got service here. I worked for General Motors, so I had Cadillac insurance, but I chose to get my health care at Great Lakes Bay because for some of the reasons that they outlined, I was able to talk to the doctors on the same level. They listened, and they helped. And I became an advocate, just as they are going to become great advocates. Health centers, from the very beginning, have recognized that health is extremely dependent upon social and economic factors. That is why community health centers have been a leveler for social change. We at Great Lakes Bay Health Centers have been totally committed to this work. We pay attention to intervene upstream in the root causes of what's making our people sick. That kind of social and environmental intervention is part of the work that characterizes the community health centers at the beginning. We have also found ourselves involved in this effort to improve the learning process for patients. We have quietly been successful in helping people to become productive as it relates to their health without holding their hands, as you saw from Ruben and from Christy. This is the great challenge that we have met, and I am a personal example of that work. Now, we ask you to get involved so that we can continue this wonderful movement. We have found the biggest need in the people we serve is a need for them to achieve in community life, to be part of something, to own something. And that's the way they feel about this thing called Great Lakes Bay Health Centers. You feel that you own it. Every member has the opportunity to excel because they are a part of something. Today we hear the Great Lakes Bay Health Center story and we meet some of our wonderful people and patients. And it is my privilege to ask you to make a financial investment to support our day-to-day operations. Today we are here to grow our Giving Society. The Giving Society. If you have been inspired by what you've seen today and you would like to support the ongoing operations needs of our Great Lakes Bay Health Centers, I invite you to join us as a member of our Giving Hope Society. Before I ask the table captains to pass out their pledge cards, I know they're getting ready. We have something very exciting to announce first. Because of the generosity of the group donors, we are also happy to announce that we have received leadership gifts totaling more than $34,000 to support this effort. And we thank you. This gift will go a long way towards our goal of providing health care to everyone who needs it right here in the Great Lakes Bay region and beyond. Thanks to those donors for their support and for inspiring all of us to join with you today. Some of you who are here today attended this event last year and you pledged your support. We thank you sincerely. We would ask you to consider paying off your pledge early and or increasing the amount you pledge. As I go through the levels of giving in our Giving Hope Society, please note that there is a special section on the back of the pledge card for you. Now, I would ask the table captains to pass out the cards. the pledge cards. And we'll take a few minutes for you to be able to get those, and then we'll go over the next step from there. I will outline to you how those cards work once they are given to you, and how you can work to continue to support us in this great movement. And we thank our table captains. Starting at the top of the card, there is the Giving Hope Society pledge level names. They are meant to give you a sense of what your contributions can do. 100% of your contributions will go directly towards patient care at Great Lakes Bay Health Centers. The first level, Reaching Out, is a pledge of $1,000 each year for 5 years, which is about $83 a month. What will this do? Your gift will allow one patient like Ruben or Christy to have 5 years of comprehensive medical care, which can give them back their health. Not only give them back their health, but get them to become activists to help others. The next giving level, our Healing People level, is a pledge of $5,000 a year for 5 years. A gift at this level will allow us to provide 5 years of dental care to 13 patients without dental insurance, giving them back their smiles. And when it comes to health care, dental is an important part of being prevention, a very important part of prevention. The last level, Building Healthy Communities, is a pledge of $10,000 a year for 5 years. This kind of gift is enough to provide substance abuse treatment, counseling, and support services to patients over a period of 5 years. And we have committed ourselves with the same level of commitment to help with the opioid crisis. We need your help. Restoring hope to the hopeless. If you are joining us today to become a member of the Giving Hope Society, a group of special donors who will help us transform lives, thank you on behalf of all the people we serve. For those of you who may prefer to give a different level, on the next line, if you take a look, please tell us how much you would like to give and for how many years you would like to give it. As long as your gift is for $1,000 or more per year for 5 years, you can join what's called the Giving Society. Whatever level of support you can provide, we ask that you make your first payment on your pledge today. Perhaps you would like to make a gift of stock or something else, or simply have some great ideas for us. We've been getting those, and we welcome those. In order for us to be innovative, we need your input in that area too. If so, please check the next box, the one that says, please contact me. I have other thoughts to share, and Jill will get back with you on those ideas. Please know that whatever you have given today, including the gift of your time spent with us, we sincerely appreciate your support for the patients we serve. I'll give you a few minutes to finish filling out your pledge card. And when you are finished, please pass your card and gift to your table captain. And we want to thank you so much for your attention and your time and your contributions for this noble effort.
Thank you everyone for taking the time to fill out your contribution. If you have any questions, please ask your table captain. On behalf of everyone here at Great Lakes Bay Health Centers, the patients, the board, and our team, we thank you for coming and for all of your support today. We hope you'll share with others what you've learned and heard here today to inspire others in the community. If you haven't joined us at a Together event, please join us for an upcoming tour. And thank you very much for your time today. We really appreciate it. Have a great day.